much. As the U.S. nears 100,000 deaths from the pandemic, about a third of Americans now show signs of clinical anxiety or depression, according to the Census Bureau. The psychological toll on frontline medical staff is especially dire. Last month, a top Manhattan ER doctor who treated COVID-19 patients committed suicide. And with the economic downturn, mental health experts are worried about the road ahead, as new research shows that rising unemployment could lead to more suicides. Joining us now, Ronnie Frank. She's a co-founder of Talkspace, an online therapy company that's facing a surge in new clients seeking help with mental health. Thanks for joining us. And give us a sense of now how these sessions are taking place and some of the new people that might be seeking help.
Hi, thank you for having me. So just a few words about the bigger picture of mental health in America. Even before the pandemic, the mental health system in America was in crisis. Just to give you some numbers, before the pandemic, each year, 50 million Americans are diagnosed with a mental health issue, usually depression or anxiety. However, 70% of them have no access to mental health services due to cost, lack of access, or stigma. Every year, about 50,000 Americans are dying by suicide. Since the pandemic started, anxiety and depression have heightened dramatically, and with the massive economic crisis we're facing, and on top of it, isolation and loneliness and uncertainty, we're facing an unprecedented mental health epidemic in this country.
Willie.
Yes, Ronnie, it's Willie Geist. It's good to have you on this morning. We know that loneliness already was a big problem in our country, one that's not talked about enough, and that's only been amplified and made worse by the last few months for all the obvious reasons. I'm curious about kids, too, because I think sometimes kids don't express themselves when they're able to talk about how they're feeling and about their mental health. But they're not seeing their friends. They're not playing Little League and going to dance recitals and being in all those groups that help them grow. And I think that comes out in kids once in a while, that they're emotional about what's happened over the last 3 months. What can you say about mental health in children and what parents can be looking for there?
You know, children, of course, dealing with a lot of anger and frustration, you know, the loss of graduation, the loss of summer vacation, loss of camp. They really miss their friends, they miss school. But I really want to talk about more population that are vulnerable to mental health issues. You know, it's very interesting because it changes over time. In the beginning of COVID, we saw a lot of people that either they or their loved ones suffer from underlying health conditions such as heart issues, diabetes, cancer, all chronic illnesses that cause you to be more susceptible to the virus. That led to a lot of anxiety and panic. Over time, we started seeing other populations, for example, people who live alone, you know, quarantines and social distancing, working from home. All of this is very isolating, many people who live alone, and that led to depression. And then we started seeing a lot of couples on the platform. Relationship under quarantine is a huge stressor as well. Many couples are really struggling now. They're fighting more, and at the same time, they are dealing with their kids and with the frustration of the kids and with online school, and it takes a toll on the relationship and also. Excuse me?
All right, Dr. Ronnie Frank, thank you very much for joining us. And we want to
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.